This is Dr. Paul Thomlinson from Compass Health Network, and this is our podcast aimed at inspiring hope and promoting wellness. Here we try to offer listeners a better understanding of some of the challenges of these times we're living in and living through. An understanding built on insights from research in the social, behavioral, and health sciences, as well as from stories of lived experience. The bottom line is we need to find and apply the best evidence we can so that we can know, do, and be better and better. This episode is timed to observe HIV/AIDS Awareness Month, and we want to use the opportunity to inspire hope and promote wellness, as in all things Compass. So we want to remind folks about the importance of getting tested if you're at risk. And of course, we want to raise awareness around HIV/AIDS, show support for people living with it, and unite in the fight against the virus and its consequences, including stigmatization. And I want to focus here on hope in a few ways. First, by talking about the advances in HIV/AIDS care and successful stigma reduction, and the lessons we might learn for reducing and eliminating stigma around mental illness and other stigmatized conditions. Hopeful lessons there for sure. Then I want to introduce you to a young man named Brryan Jackson, who has one of the most astonishing stories of tragedy transformed into hope that I've ever heard. He's lived with HIV since he was literally a baby, as his father intentionally injected him with HIV-tainted blood when he was 11 months old. Now, I had the opportunity to talk with him about his experiences and his message. You'll hear from him just a bit in this episode, but it's going to take a couple more in a series to unpack some of his story, so watch for those in the next month. Now, what lessons can we learn from the history of HIV/AIDS that apply to reducing mental health stigma, or any stigmatized conditions really? I thought you'd never ask. I remember my first dawning awareness of HIV/AIDS in the early 80s when I was a college student, reading about it in Time magazine, seeing early reports of what was sometimes called GRID, gay-related immunodeficiency disorder. More evidence of the rank stigmatization and ignorance of the time about it. So I'm also old enough to remember when HIV/AIDS was pretty much an absolute death sentence. I mean, people invariably died from it after being cast as pariahs, because it was mostly occurring among marginalized groups at the time. Gay men, IV drug users. Honestly, it was a dark and hopeless time for many. But something incredible happened. Advocacy, based on storytelling of lived experiences. AIDS advocacy groups began to stand up, refuse to be silent, and insist that more be done to understand and treat this deadly scourge. And guess what happened? Within a few years, scientists had isolated the virus that causes AIDS. And within a few more years, the drug AZT had been developed and was saving lives. All because people spoke up and refused to allow stigma to prevent progress. That's an amazing story. I mean, again, I remember in the early 80s, it was announced that Rock Hudson, the Hollywood leading man, had AIDS, and he was dead within a year or so. And I also remember in 1991 when Magic Johnson announced his illness. And guess what? He's still around, living a pretty much normal life. I saw him on TV just the other day in 2022, over 30 years after his announcement. But the key here is, what a difference between 1981 and 1991. What a difference that 10 years of advocacy, refusal to accept stigma, and the resulting research and technology made. Now, HIV is less like Ebola and more like diabetes, if you'll pardon that analogy. Not a virtual death sentence, I mean, but a condition that can be managed and integrated into a full, rich, long life. And isn't that what we want for all? Maybe especially those with mental illnesses? We want a world where the narrative is one of hope and healing and radical acceptance, not stigmatization, which is both built on and leads to ignorance and lack of progress. Speaking of narratives of hope and healing, let me end this episode by introducing you to Brryan Jackson. Again, injected with HIV-tainted blood by his estranged father at 11 months of age, ostensibly to avoid paying child support. Brryan today stands up on TED Talk stages and TV shows and conferences and says things like this: "Hope is what says after a dark night comes a bright sunny day." And grass is not greener on the other side of the fence, it's greener where you water it. And hope allows adversity to build your character rather than break you down. Those are just a few of my favorite quotes, culled from hours of deep diving on YouTube for videos about this remarkable young man. But I want you to hear directly from him, so here's a taste of our conversation. And please remember, you can hear the whole thing in upcoming episodes.
Thank you for inviting me to go on this journey with you. As a person who is not only an advocate of hope, I'm also an advocate for mental health services and find them very important to our life. And I appreciate that Compass Health does that to not only the St. Charles County community, but different counties across Missouri. So thank you guys for what you do at Compass Health. And yeah.
I can tell we're already going to get along famously. Anybody who is a mental health advocate is a brother of mine. So, if you don't mind, maybe we could start by just having you tell your story. For those who haven't heard it, it's an amazing story, and you can tell it however you like. I've seen enough videos to know you're a great storyteller. If folks haven't spent hours on YouTube looking at all the videos of you on TV, on the doctor show and all that, then like I have, give folks your story. And by the way, when you tell your story, it will become immediately obvious why the first episode of this series is being done during HIV Awareness Month. So tell us your story if you don't mind.
So in 1996, I went from being a playful, happy, energetic 5-year-old to this bloated, feverish, sick kid. My body was breaking down, and my mother and my doctors didn't know what was going on with me. I was tested for numerous diseases, even rare ones that only exist in several countries. But finally, they said, this is weird, but let's test them for HIV. And the results came back, and I was diagnosed with full-blown AIDS.
That was at age 5, right?
At age 5.
Okay.
So I wasn't supposed to see the age of 6. But here I am today, healthy, joyful, and hopeful. So how did I contract HIV since I wasn't at risk for it? Well, it turns out that my father, who was a phlebotomist, stole HIV-tainted blood from his hospital he worked at, smuggled it into the hospital I was staying at. I was born with asthma complications, and so around 11 months old, I was in the hospital for another asthma attack. We were waiting to be chucked out of the hospital. I was good to go. And all of a sudden, my father made a surprise visit. The reason why I say surprise visit is because he wasn't a very active father. He constantly referred to me as somebody else's kid. He accused my mom of cheating, constantly didn't want anything to do with me. The week that I was in the hospital for an asthma attack, my mom thought that any, loving parent would want to know that their kid is in critical condition. And so she reached out to him at the hospital he was working at and said, "I'm trying to get a hold of Mr. Stewart. Is he available? His son's in the hospital." And the response my mom got was, "Mr. Stewart doesn't have any kids." So then the day I'm being checked out of the hospital, here he appears out of nowhere with his lab coat. Nobody even asked him about his lab coat. He's like, "Oh, I brought this in because I didn't want it stolen from the car." And my mom had already been up, all the nights with me. She was hungry, tired, and really just wanted something to drink. And so when my dad got there, she was kind of like hesitant, but didn't want to argue. And she just really wanted to get something to drink and said, "Hey, we're waiting for the discharge papers. Can you go get me something to drink?" And his response was, "No, I'll stay here and watch your kid while you go get something to drink."
Watch your kid.
And so my mother left me alone in the room, and because what's the worst that could happen? She went down to the cafeteria to get something to drink, and that's when it was predicted that my father took out the stolen HIV tainted blood and intentionally injected me with the virus, hoping I would die off and he wouldn't have to pay child support. Not only was it HIV tainted blood, it was also incompatible blood. So my vital signs started going out of whack. I'm screaming and crying. My mom gets back into the room, trying to figure out what happened. Doctors and nurses are trying to figure out what happened. They want to transfer me to another hospital. My dad says, "Oh, I got to get back to work," not even caring about my well-being. Doctors were able to stabilize me. They were like, "That's weird." So all this wasn't uncovered until when I was sick in 1996, and they launched an entire investigation to figure out how I contracted HIV tainted blood because I was not at risk. And through the investigation, they found opportunity and motive through my father. The motive was he didn't want to pay child support. He's actually admitted during his parole hearing that he has intentionally injected me with the HIV virus, and he didn't want me to grow up with complications, meaning asthma complications, a thing that millions of people have normal lives with. But he was sentenced to life in prison. I have no contact with him. And
So did you have any contact with him between 11 months and 5 years when you were diagnosed with full-blown AIDS?
About a month after the incident, he just told my mom, "Don't bother looking me up for child support. Your child's not going to live long." And she's like, "What do you mean by that?"
Well, that's the beginning of this jaw-dropping, breathtaking story, and you don't want to miss the chance to get to know Brryan Jackson better. Stay tuned for more in the coming month. And in the meantime, you can find him on social media at Brryan Jackson. That's BRRYAN Jackson. At Brryan Jackson for Instagram and TikTok, and he's also on Facebook. He has a clothing company called Hope is Vital. You can find them on social and on the web. And they're actually doing a mental health fundraiser right now. And his website is brryanjackson.com. Stay tuned for more.